Welcome to this session of the PlantPure Summit 2016, co-sponsored by PlantPureFoods.com. Our guest is Dr. Laura Morris, MD. Dr. Morris is a breast surgical oncologist. She has exclusively practiced breast surgery for 21 years and incorporates lifestyle medicine and plant-based nutrition with her patients. For 16 years, she has been an integral part of the Goshen Center for Cancer Care in Goshen, Indiana, which features a uniquely integrated team model of cancer care. She was also the vision behind the development of the Retreat Women's Health Center in Goshen. As medical director of the retreat, Dr. Morris consistently strives to educate the community about healthy lifestyle choices. Welcome to the summit, Dr. Morris.
Thank you. Thank you, Lee.
So when and why did you decide to become a doctor?
Oh my goodness, that question goes way back. Actually, I wanted to be a doctor from elementary school, but then the theater bug bit me, and I decided I was going to go into musical theater. So my undergraduate education is primarily in music and dance, and then I decided I really wanted to get involved back in medicine, and what I was interested in at that point was something called dance medicine, which is kind of super specialized sports medicine for the dancer. So I went to medical school with the idea of becoming a family practice doctor specializing in dance medicine, and then decided that I really liked procedures and surgery, so then went that way. So it kind of had, a little bit of curvaceous route getting there, little serpentine.
Serpentine, that's a great word. Yeah. So when and why did you decide to concentrate on breast cancer, breast surgery cancer?
Well, it kind of really brought together what I wanted to do in medicine. I really liked the concept in family practice of getting to know the patient and long-term relationship with the patient. But I like the procedure part of surgery. And unfortunately in surgery, most of the procedures are kind of one and done. You take a gallbladder out, you never see a person again. You take the appendix out. But with breast cancer, you are involved in that woman's life, you're involved in her family's life, and you see the patients not just post-operatively, but the way my practice has evolved is I see my patients long-term. And you see high-risk women, so women who either have a family history of breast cancer or have other abnormalities that you see quite frequently, and frequently in my practice would be maybe 3 times a year. So you'd really get to know these people and can affect their lifestyle. And so it brought together the procedure part of it and the relationship building part of practice.
So when did you decide to integrate plant-based nutrition in your practice?
That came about as part of how I ended up in Goshen, actually. After my fellowship in breast surgical oncology at Michigan State, I stayed there for 5 years. And I know I became very interested in women's health. So women obviously are more than just their breast, and they have, a lot of other problems. And how could I affect changes in a woman's overall health and lifestyle? So I went back to school while I was on faculty and got my MBA at that time, and really wanted to incorporate or bring together a woman's wellness, a women's health center. And so at about that time, I was looking to move from what I was doing at the university into a more holistic type of practice. And so one thing led to another, and Goshen is in northern Indiana. Most people don't know where it is. I didn't know where it was, and I only lived about 2 hours from it. It's about 20 minutes east of South Bend, Indiana, about an hour south of Kalamazoo, Michigan. And they had just built a cancer center here. And Goshen Hospital was looking at how to integrate a cancer program into a more holistic approach. And they looked at several approaches and came up kind of with a combination of what Cancer Treatment Centers of America does in addition to what we consider Western medicine, and brought it all together here in Goshen. The program had been here for about a year and had 1 surgeon, 1 medical oncologist, and was expanding. So they actually, the number 1 cancer here was breast and needed a full-time breast surgeon. And it kind of, our worlds collided. They recruited me here. And what brought me here is the cancer center. And the model that the cancer center uses is we have all of our Western medicine physicians are fellowship trained. So we have surgical oncologists, medical oncologists, as well as radiation oncologists. So we have, what we consider traditional cancer care in the United States. But then we brought together complementary or alternative practices, which include full-time naturopathic physicians. We have oncology dietitians. We have a component called psychoneuroimmunology, because we know how we think and how we process information has a role in how our immune system works. So we have counselors. We also work with spirituality as well as group process. So we bring together the whole component of cancer care and keeping the person well and leading them into a full treatment protocol, if you will, incorporating the surgery, the chemotherapy, and the radiation, and the wider practices of health and nutrition and supplements and vitamins and minerals, as well as the psychology of cancer care. So that's how I got here. And as most physicians, I had absolutely no nutrition training in medical school, knew nothing about it. If I actually told you what my nutrition consisted of in residency, most people would probably run screaming from the room. And when I became involved with the cancer program and started talking with our naturopaths, and naturopaths are trained in wellness. They're trained in, how do you get someone to think about what they eat, what their physical activity is, perhaps what supplements they're using to keep their body well, so perhaps they don't get disease. They're not diagnosed with something catastrophic that needs to be treated. Whereas how I was trained, most MDs and DOs are trained, is we don't really worry too much what a person does until they get their disease. And then once they're diagnosed with something, then we throw pills at them, we throw operations at them, chemicals, radiation. So it was getting to know those naturopaths and hearing more of how their training was that really got me interested in the wellness and the nutrition part of, how to treat patients and how to take care of people.
So where did you get your information on plant-based nutrition?
Well, I started just socially with our naturopaths, and then a couple of the other practitioners within my group were very interested in nutrition. One of them a radiologist, and he at that point was very much into the Atkins program. And he and I would sit down and talk about that. And then somebody within our group actually had bought a copy of the China study. And that kind of spread like wildfire through the system and really got us interested in plant-based nutrition and on board of the plant-based program. I had taken, Harvard Health has a program called Healthy Kitchens, Healthy Lives that they do in cooperation with the Culinary Institute of America, CIA, out in Napa, and I had taken that course. And then after reading the China study, did Dr. Campbell's course through eCornell and received my certificate in that, and then really became active in the American College of Lifestyle Medicine, the American College of Preventive Medicine. Actually did 2 of the holistic holiday at sea trips, where that really, again, gave me much more information in the plant-based lifestyle, and I was able to interact with the luminaries in the plant-based world and really learned about how to bring it then here to my practice and to the wider community here in Goshen. I'm also currently the American College of Lifestyle Medicine and Preventive Medicine put together a series of core competencies in lifestyle medicine. And so I've been working on those core competencies also.
So what was the attitude of your colleagues when you first started to integrate plant-based nutrition into your treatment of your patients?
Well, I would say within the cancer center, it has a good reception because we're already working with dietitians, we're already working with the naturopaths, but we don't talk, we don't really promote a lot of plant-based diet in and of itself. We encourage patients to increase their intake of vitamins, or excuse me, of vegetables and fruits and grains, but we don't necessarily tell them to stop eating animal-based products. We still have people within the cancer program, providers that will encourage cancer patients to make sure they're drinking their dairy and they're getting their cheese because they need to, work on their calcium intake. So I've had a lot of discussions with dietitians, with other providers, and there is some pushback about making patients what we call vegan. And I am not a vegan. There to me is a delineation between promoting whole food plant-based way of eating and nutrition versus being vegan. It's not wrong to be vegan, but I think people are vegan for ethical reasons. And as most of us know who are participating in the summit, you can be a vegan but have a horrible diet. You could be drinking, sodas and eating processed foods, but you're still vegan. So it's not about being vegan. It's about looking how what kind of nutrition we're putting in our body and doing that in the healthiest way.
So overall, what is the acceptance among oncologists that you're aware of the efficacy of plant-based nutrition as a treatment for cancer?
I think in a community as a whole within the oncology world in the United States, I think there is not a lot of awareness of plant-based nutrition as part of a treatment and prevention for cancer. I think we're in our own little world as oncology specialists and do what we do in that world, whether it be surgery, whether it be chemotherapy or radiation, and don't really pay a whole lot of attention to the wider picture. I think it's really not seeing the forest through the trees, and that everything a person does really does play a role in either the prevention of disease or in treating their disease and helping them recover.
It seems like individually tailored genetic therapies are now the big thing in cancer treatment or in research about cancer treatment. What is your take on that approach to cancer treatment?
Well, especially in the breast cancer world, we know once a woman or a man is diagnosed with breast cancer, the more we focus on specifically how we can treat that, really the better. When I started doing this, when I was in medical school over, 25 years ago, I guess, a woman was diagnosed with breast cancer. The treatment was pretty standard. Everyone had an operation. A huge percentage of women had chemotherapy administered to them and radiation. And it was just one of those things of throwing everything you could at it to decrease the risk of it coming back, while not really understanding the disease as much or at that time as we could. And now with newer tests, there are genetic tests available on the tumor itself, which can tell us what is the likelihood of that tumor returning. So that in and of itself can show us which women are more likely to benefit from chemotherapy as opposed to giving every woman chemotherapy. And the women whose tumors are less likely to recur don't need chemotherapy. But then incorporating the lifestyle medicine concepts with that, I think are important, but we still need to treat the cancer. I'm not at this point in my practice that I'm not advocating for the Western medicine practices of breast cancer and looking totally at alternative therapies, but how do we incorporate the therapies to better treat the cancer itself?
So what do you think? There are stories every once in a while about women who have preemptive surgery, just when they understand that they have the gene for breast cancer, they go ahead and get a double mastectomy right away. What are your feelings about that?
Yeah. And Angelina Jolie obviously was the big celebrity that brought a lot of that into the forefront. The thing with the genes, and you'll see it start coming up in October when it's Breast Cancer Awareness Month, and we start seeing a lot of it in magazines. Number one, we all have those genes, BRCA1 and 2, or some people call them BRCA1 and 2. We all have those genes. They function as tumor suppressor genes. So we are always getting cancer cells in our body, and a cancer cell really at the most fundamental level is a cell that is growing abnormally. And so those genes function as tumor suppressor genes. So when we have those abnormal cells forming, those genes will go out and take care of it. So in women who have, or men, have a mutation or abnormal copy of that gene, it doesn't function correctly. So they're at a higher risk of getting breast cancer, being diagnosed with breast cancer, as well as ovarian cancer. And there are many options on how to reduce that risk. So if a woman is in a family that has that high concentration of cancers and they're tested and they have an abnormal copy, then they have choices of what to do to reduce the risk of getting breast cancer and ovarian cancer, because ovarian cancer, I think, is even a little more scary because we don't have any screening tests for it. With breast cancer, we have mammograms, we have MRIs. With ovarian cancer, there's nothing. So oftentimes when women are diagnosed with ovarian cancer, it's much more advanced and sometimes not as treatable as breast cancer is. So a woman could have her ovaries out. Taking a woman's ovaries out also will reduce their risk of breast cancer. But having their breasts removed will reduce their risk of breast cancer. The one key thing is it doesn't eliminate the risk of getting breast cancer. And I think that's something that's very misunderstood, that yes, you can do mastectomies and do reconstruction and have great results, but there is about a 1 to maybe 3% chance that a woman will still be diagnosed with breast cancer after what's called prophylactic mastectomies. And that's because we have to leave a little bit of padding underneath the skin, or the skin is going to die. Within that padding, there are going to be some breast cells, and those cells are at risk of becoming cancerous just like the rest of the breast tissue is. So if a woman is ultimately diagnosed with breast cancer after she's undergone all of these treatments, that is particularly troublesome and discouraging for her because she thought she did all of this to prevent it. That said, that would be the most drastic thing a woman could do to reduce the risk of getting cancer. She can take a medication, most often called tamoxifen, it's a selective estrogen, which can decrease her risk of being diagnosed with breast cancer. Lifestyle changes are huge. Adopting a whole food plant-based lifestyle of eating, increasing activity, we know those are going to decrease the risk of breast cancer. And there is data that after a woman is diagnosed with breast cancer, if she adopts a whole food plant-based way of eating, the risk of recurrence is actually lower than if she continues eating in the SAD or standard American diet fashion that, most of us have.
Are you aware of any cases of women who have had the prophylactic mastectomies who then subsequently did get breast cancer?
I'm not aware of women who had prophylactic mastectomies, but I have seen women in the past 21 years who had a mastectomy to treat their breast cancer, and all appropriate treatments also, in addition to whatever else may have been recommended, but did have a recurrence in that mastectomy flap or the skin. And, very upsetting because, they did that thinking they were done. They didn't want to ever have to deal with it again. So I myself have not seen a woman who has that prophylactic mastectomy, but I know the risk is there.
Wow, that's got to be a really tragic case for any woman who has gone through the experience and then has to go through it again. I can't even imagine that's like.
And she said, well, nobody ever told me that. This is why I did it, because I didn't want to deal with it again. So, and then even right now, there's a lot of controversy. Many women who are diagnosed with breast cancer will come in, throw their hands up and say, just take them both off. I never want to deal with this again. And the chance that a woman is going to get breast cancer in her other breast is actually very, very low. So really trying to do a lot of education. The American Society of Breast Surgeons have actually put out some education material that having the other healthy breast removed is not going to affect a woman's chance of dying from her original breast cancer. So, it's really, because it's when you're diagnosed with any type of cancer, it's very stressful and you just want to get it over and done with. And breast cancer, obviously what I deal with, I see those women who just, it's like, I never thought it was going to be me and I just want to be done with it.
When and why did you open the Retreat Women's Health Center?
Well, the retreat actually developed from the Center for Cancer Care because that had such a great integrated model of care. So when a patient would come into the cancer center, they would see the MDs, they would also see the complementary therapy practitioners, and we all function as a team. So once a week, we all sit down and talk about either our new diagnosis of cancer patients or our patients in active treatment, so we can all get a handle on what's going on. We have the psychoneuroimmunology component, which is our master's prepared psychologist or social workers that can help with the patient's treatment and how their mindset is. And so as I was working with this integrated cancer team, I thought, wouldn't it be great to have that in a women's health program? And to be able to integrate that, to be able to address women's health needs, not just offer this to cancer patients. So with my MBA, and the Goshen Health System had been thinking about doing a women's health center just about the time I got here. And as we started talking, the enthusiasm really took off for putting this model into a women's wellness center. And that's how the retreat was born. The name, boy, that was 16 years ago, how we came up with the name. And I think we had many iterations of what we should call it. And interestingly enough, a lot of the oncologists in our program didn't like the name retreat because they thought it meant that their perception in their world was you didn't treat the cancer appropriately or you didn't treat the patient appropriately, therefore you needed to retreat them, as opposed to a retreat, which is a nice calming place to go and have your healthcare needs addressed.
Well, yeah. Well, I think you came up with the right name there. Actually, that's the way I think of it when I hear the word retreat. I certainly don't think of retreating somebody, or like retreat as like run away or something like that.
Now that's interesting. We didn't think about, run away, kind of we're retreating from the battle. But yeah, it's just a nice space. It's off campus. It's about 3 miles from the main hospital. So it's easy to park. When women come in for testing or x-rays, they don't have to then go through the main hospital lobby and go to the x-ray department and sit in a waiting room with people who have, other things going on. I often heard stories of women who would go in for a mammogram and they would be told to change, and they would, take everything off from the waist up, and they'd be given a thin little gown that they were then sitting in this general radiology waiting room, clutching the gown because they didn't want anybody to see anything. And so how we developed it here is that it's all very private and a personal type of service. When a woman comes in for a mammogram, she's led to her personal changing room, which is actually connected to the mammogram unit itself. So she goes in, she locks the door, she changes into a tasteful cape, but she's never walking out in public. She's not in a waiting room, half undressed with other people. The technologist then calls her into the mammography room from the door at the other side of the changing room. She comes in, gets her mammogram, any additional testing, and then goes back into her individual changing room where she changes back, and we have amenities there. We have the deodorant and powders and hairspray that women need. We need those to survive. And then once she's done, she then just walks out of her private changing room and she's done. So we say it was developed by women for women.
So what specifically do you do there?
Good question. What I do here is I am part of the Cancer Center, but since all of our women's imaging is out here, my office is out here at the retreat. So I see women who have breast problems here. I do image-guided breast biopsies. So if a woman has an abnormal mammogram or an abnormal ultrasound and needs a biopsy, they have the option of having a radiologist do that procedure or myself. So I will do the biopsies under what are called stereotactic conditions, which uses a mammogram machine to find something, or an ultrasound. So I'll perform that biopsy. We'll get the women the results within 24 hours, because once a woman has an abnormal test, certainly the next step is the biopsy. But once she has that, then she wants to know as quickly as possible, what are the results? So we get the results within 24 hours, and then follow up if it's benign, or if it's a cancer, then we have a navigator, and we can facilitate the entryway into the cancer program then, and our interdisciplinary cancer conference that I spoke about earlier, when we talk about the new cancer diagnoses and what then from a cancer standpoint is the appropriate treatment for that woman. So, and I'm also the medical director out here, so I oversee all of our quality programs as well as what type of programs we're offering within the system.
So what's the difference between treating a patient and healing a patient?
I think that is a fascinating question because, and I will tell you, I never really thought about that. I think the difference is we can certainly treat a patient. A woman has breast cancer. We can treat it. We can do her surgery. We can give her chemotherapy, give her endocrine medication to take for 5 years, do radiation. So we've treated that cancer. But I don't think in doing that, you've necessarily healed that patient. And I think that's where the other components of treating someone like you want to be treated actually come into play. So how do we heal that person? How do we, address just how they're coping with this in their life, how they're able to do things on a daily basis, whether it be within their job or at home with their family. How do we then address their overall lifestyle? Are they getting the nutrition they need? What is a wall? What's in the way of that happening? I think that's really where healing comes into place. It's different than just the treatment. And I think a lot of places, as I really thought about that, don't address the healing. They treat patients, and patients aren't necessarily known by their name. One thing we hear over and over again here is that everybody knows my name, whether it be in the operating room, whether it be coming into a new office for the first time. Everybody addresses me by name. They know who I am, and I feel like I'm among friends, as opposed to, when I was at the university, as a whole, I've always been very personally, I think, in tune to who that person is and asking them about their kids or their grandkids or their last vacation. But oftentimes patients are known by that person in room 4 or that person who has the colon cancer. Just connecting on a person level as to who that person is, not necessarily just treating their disease. And I think that's really what healing is about.
So do you have any noteworthy or remarkable patient healing stories that you could share with us?
Well, one that really came to mind, which really for me brought to the forefront the plant-based eating, was not a breast cancer patient. It was a man who was diagnosed with stage 1 lymphoma, and I think it was about 5 years ago now. And he had been to 3 other institutions who all told him that he needed chemotherapy, and the sooner he started, the better. He met with one of our medical oncologists who had the same opinion. It was a biopsy-proven lymphoma. And what he was looking for was more of a wellness approach to his lymphoma. He had been doing a lot of reading and he had the traditional American diet, is my understanding, and said, boy, there is a lot of information out there about people who have healed themselves just by lifestyle changes. And he talked with the medical oncologist, and the oncologist at that time was working with a nurse practitioner who is very much into lifestyle medicine and whole food plant-based. And he said, I want to give me 3 months, doc. I'm going to dramatically change my life, and I want to see what happens. Well, the medical oncologist, who was one of our older seasoned pros, we'll call him, kind of laughed and chuckled and said, fine, go do what you want. We'll have you come back in 3 months. And then, it's not going to be too late to start your chemo then. On a dime, he changed his complete lifestyle. He started exercising, which he hadn't been doing, totally plant-based diet. One of those really turn a switch on, and this man changed his complete lifestyle. Came back 3 months later, had a workup, and there was no evidence of disease whatsoever. None. Completely gone. And I was told recently that he had complete scans again just a couple of months ago. Still, there is no evidence of any lymphoma. And so he's been very instrumental in our greater community in trying to get more of an awareness of what lifestyle changes really can do to your health and even disease once you've been diagnosed with that. And, we know that we can reverse heart disease. Dr. Esselstyn and Dr. Ornish have shown us that we can reverse heart disease by adopting a plant-based diet that's salt, oil, and sugar-free. Dr. Ornish has some data that prostate cancer can be reversed with diet. And there is starting some data that maybe early breast cancer can also be reversed. So those things really, to me, bring to light that we can be and should be more in control of our own outcomes and our health.
So what did this patient's oncologist think about his remission?
He was really rather startled, and I will say he has since retired, so I don't know how much of a believer he is now about really dramatic lifestyle changes. He is one of those people, who many physicians are, who say anything in moderation. And as we know, moderation is basically an excuse to continue doing something that you shouldn't be doing. But very stunned that, and I think almost disbelieved that this really had happened. But we had proof.
I hear, some doctors call it spontaneous remission.
Right.
So, if they don't know what to attribute it to, they'll just say, well, it was, this happens sometimes. Spontaneously, it goes away. So
it had nothing to do with anything you did. It just happened.
Yeah. So do you think that's pretty much where this doctor was in terms of how he viewed this patient's remission?
I mean, it very well could have been, certainly thrilled for him and continue to be thrilled for him. But for me, it's evidence that our health is pretty much in our own hands, which I think Americans on a whole don't buy into. I was having this conversation earlier that as Americans, we're brought up that, let's have fun, enjoy ourselves. And if something goes wrong or goes bad, we can fix it. Doctors can fix it. They can give me a pill. They can do an operation. So we just do what we want to do with really maybe have some awareness of the consequences, but really don't want to change our lifestyle. When the article came out about processed meats, increasing the risk of cancer, oh my gosh, I think most of us have heard over and over again people saying, I'd rather die than not eat bacon. I'm not sure when bacon became such a thing, to be honest with you, that people really would give up their lives for bacon. But it's just the American thought process. I mean, I cannot be deprived of my bacon.
Yeah, well, it seems to me that people have an emotional attachment to their food that it's not the case in other areas of their life. I mean,
right.
They connect it with family events, going to grandma's house for Thanksgiving or Christmas dinner and stuff like that. And when you tell them that turkey that grandma has been giving you is not good for you, I think that may make them a bit more resistant.
Right. Well, how could turkey not be good for me? Then we've all heard that those of us that are, more in the plant-based world have heard over and over again the arguments, well, people have been eating turkeys for thousands of years. So how could turkey be bad? It's an emotional attachment, and we tend to reward people, ourselves included, with food. Within, the challenges, and I know we're going to talk a little bit of how do we incorporate this in mainstream medicine, but the challenges of even within healthcare institutions, rewarding people with food. Our volunteer organization had a fundraiser recently. Within our community, there is a great Amish bakery that makes the most awesome donuts. I mean, they really are awesome. And people refer to them as Amish crack, okay? Because they're amazing. So what they did, their fundraiser was to sell dozens of these donuts, which they did without problem. But okay, can we do a different fundraiser than selling people these amazing donuts, which are not going to be that healthy? Are people going to die from eating a donut? obviously not, but it's when you're eating 2 donuts every day that is really going to muddy the waters. And so it's looking at how can you be as healthy as possible.
So what do you think are some of the biggest problems with America's healthcare system today?
Well, I think one of the biggest problems is it's not wellness based. It's treating disease after it occurs, which I mentioned before. So, within the offices, primary care doctors, they're telling people, yes, you need to follow a 1,200 calorie diet, get some exercise, go out and do it. We don't teach people how to do it. We don't tell them what that means. A 1,200 calorie diet, okay, are we just, well balanced? I forgot the well balanced part. A 1,200 calorie well balanced diet. What does well balanced mean? And we're, dealing with communities now where people didn't grow up with the tradition of eating at home. It's maybe second generation of getting food at the drive-thru because it's fast, it's cheap, and it's easy. So someone might consider it a well-balanced diet. They're getting their meat in their hamburger. They're getting their vegetables in their French fries. Plus they're getting some vegetables in their ketchup. And if they're drinking a milkshake, well, that's their dairy. So that, that could be considered well-balanced. So we need to teach people what is a well-balanced diet, and that being whole food plant-based is not about just eating salads. You hear that over and over again. Well, I could never just exist on salads. I would be hungry all the time. Well, nobody exists on salads. And there is such a great variety of foods out there and recipes. And for people who have internet access, you can find tons of information. There are great Facebook groups, lots of cookbooks and ideas of how to cook things, but teaching people what the diet is about and what to eat, going to the farmer's market, and then how to cook it. Again, probably second generation in many, many homes where people don't cook, don't prepare food. I think Dr. Esselstyn says if it comes out of a bag, a box, or a can, don't eat it. And, that's what people are used to. We don't prepare food anymore at home. And just sitting down as a family and eating will also help with family time and sharing, and maybe even, help some of the problems that we're experiencing as kids are growing up and wondering how to get along in the world.
So why have you chosen to transition from your current breast surgery practice to wellness?
Well, I've been doing this for 21 years, and I've been trying to counsel patients about the lifestyle changes. And, I have somewhat of a captive audience, and a lot of patients just kind of shrug their shoulders and say, you know what, I already got breast cancer. I might as well keep doing what I'm doing. And if something happens, you can fix me. I think as we continue going forward in the United States, our healthcare costs are astronomical, yet we have one of the most unhealthy populations in the world. And so my passion has become, how do I educate, or how do we as a community educate people that what they do really matters? And it's not, again, you're not going into a convent or a monastery. You can't, it's not all or nothing. Whatever you do is better than nothing. So, I have patients say, does that mean I can never go have a pizza and a beer again? It doesn't, but everything that you can do helps. So how do we educate people? In healthcare, we're also going more towards what are called ACOs, or accountable care organizations, which really is almost like managed care that we visited about 25, 30 years ago within healthcare, where insurance companies give the health system or the physician, basically an X amount of dollars to take care of all of that person's healthcare needs. Well, unless we get on top of chronic diseases, we're going to run out of money trying to take care of people who are overweight, who have diabetes, who have high blood pressure, who need heart surgery. So using some of that money and spending it to teach people how to eat, that fitness doesn't mean you have to go out and run a 5K. What does it mean to become more active? One of our local TV stations, they just talk about being active. And that's when you look at the blue zones. It's not about necessarily exercise and joining a gym and doing cycling. It's about just getting out there. I become so passionate about it. And that's what I want to follow at this point in my life, is what I'm passionate about, and really helping people to improve their life and their health. And we know from our own experiences that when people start changing what they eat and start moving a little bit more, that they really do feel better. I know when a nurse practitioner told me she finally gave up dairy, and she said, I can't believe how much better I feel. I have more energy, I sleep better. And you think, sure you do. Sure you do. Well, you really do. When you stop eating a bunch of crap, your body really runs better on plants and the whole food, trying to eat less processed food. That's the other thing. It's not about salads. It's don't eat processed stuff. And that's where, it comes in the bag or the can or the box. Try to really limiting those and how much better you can feel and much more energy for life and the things that you want to do. So it has become my passion.
So tell us about your work with Goshen Health and your vision for its future.
Oh, so my personal vision is that, we have some signature services here. Cancer is one of them. Cardiovascular center is one of them. We also have a bariatrics program and our women's program. But I really want to put together a wellness institute where we can combine what we do as far as community health and wellness. So we have a lot of programs. We have a corporate health program where we go out. We're in northern Indiana. We are actually, I'm sure many people know this, but it's the RV capital of the world. 80% of any kind of camper, trailer, motorhome is made in this region. And so there are a lot of companies here that we contract with to provide their wellness education as well as their health care. So getting that message out to them. I've looked at the Cleveland Clinic's Wellness Institute and what they do in their outreach program, and it's fabulous. And so how can we incorporate that where we're at and sending the same message? Recently, our cafeteria underwent renovation and much more plant-based friendly. They hired a chef that is great stuffed portobello mushrooms, and then bringing that into the inpatient system, which we haven't quite done yet. We have a community wellness program, and their message is a little bit different than the message we send to the corporate world. So how can we integrate all of our messages, come up with one consistent message, and then be able to educate not only our healthcare population, so our physician population, nurses, everyone, all of our colleagues here, as well as the greater community. What does it mean to eat plant-based and to move? And then how do you shop? How do you cook? Set up some partnerships with our local farms, with our community-supported agriculture, our CSA, our farmers market. It's just endless. So that's where my passion lies right now. I still, love my patients and breast cancer, but I really need to go where my passion is leading me.
So why do you think wellness is such an important component of healthcare?
Because we know there have been studies that 80% of our chronic disease can be avoided if we change our lifestyle. 80% of heart disease, of obesity, diabetes, we can actually avoid those conditions by changing our lifestyles, by changing what we eat, how we move, community groups. And I think we really need to do that, not only for ourselves, but for our families, because of the burden that chronic disease brings on not only ourselves and our families, but on the community and certainly the wider community with the financial resources that we have in this country.
So do you see wellness becoming a bigger part of America's healthcare system in the years ahead?
Oh, I think it will. I think it has to. I've heard, of some big name institutions that are scrambling now and looking at how do we address wellness. Kaiser 3 years ago, adopted the whole food plant-based way of eating as what they recommend to patients. But many healthcare providers that I've talked to within Kaiser Permanente aren't even aware of it. So they have great handouts that are available online, but some of their own practitioners don't know about it. So I think as we get the grassroots people, from the community coming up, and that it actually is much more of a surge than coming from the top down from the healthcare providers. But there are more and more healthcare providers that are saying, we can do this, and it's just an uphill battle trying to convince our colleagues within healthcare that this is important and we need to spend more time doing it. That said, it is hard for primary care providers. They have typically 15 minutes per patient. So maybe all they can tell them, all they have time is that you should follow a well-balanced 1,200 calorie diet and get some exercise. But then they need somewhere to send those people where they can have the education. And here in Goshen, that's what ultimately is going to be that place, that wellness institute, where doctors or healthcare providers can refer patients, or people can refer themselves. I want to learn more about how to cook. I can go to the Wellness Institute in Goshen. The primary care doctor who just is kind of throwing his or her hands up trying to manage a diabetic patient with medication. Well, let's look at this from a dietary standpoint. And instead of saying you need to follow a 1,200 calorie ADA diet, there's research out there that shows a plant-based diet is actually more effective at treating and reducing medication requirements for diabetics, particularly type 2 diabetics. Let's send you over to the Wellness Institute and have them teach you about this. So really coming at it from that standpoint.
So do you think plant-based nutrition do you think we've reached the tipping point in America on the acceptance of plant-based nutrition yet?
No, I don't. I still think that I don't, maybe starting the tipping point, but I don't think it's there. I think that people as a general population, why do you want to eat that way? How do you eat that way? You're crazy. Animals were put here for us to eat, otherwise they wouldn't be here. I think we're getting there. I really don't think we're there yet, but I think if we continue with the forward motion that we've created, I think we'll get there. I think we'll get there.
Well, definitely. People like you are a big part of that effort. And so thank you for your time, for being on and taking part in the summit. It was great talking with you. And is there a website people can go to learn more about what you do?
There is our website right now, which I think is linked under my bio, which currently is iuhealthgoshen.org. We will be undergoing a name change within the next several weeks. So the link will still take you to the website and they can keep up to date on what we're doing at the Cancer Center within the retreat, as well as our wellness endeavors as we move forward.
Well, that's great. And I want to thank everybody for watching. And to learn more about what we're doing to help create a plant-based nation, please visit us at our website, plantpurenation.com. That is plantpurenation.com. Thanks again, Doctor.
Thank you.